Vibrant Living is brought to you by Springwater Insurance Group, teaching you how to buy the best Medicare and supplemental plans for your needs. Aging and Adult Care of Central Washington, enhancing a person's ability to maintain a life of independence and choice. And Link Transit, take that first step. Learn how to ride.
I'm Leilani Johnson.
And I'm Carmen Johnson, her mama.
And shortly after my dad passed away from lung cancer, I felt like I wanted to do something. And I realized that once people become ill or immobile, that their feet and hands and their legs become very cold.
Well, he wouldn't go anywhere unless in his wheelchair unless he had a blanket over his legs and something on his feet. Yeah.
So we started small, just a few slippers here and there and a few lap robes, and took them to Colonial Vista and the Cancer Care House, and they loved them so much that we just kept going. And we've been funding this mostly by ourselves with a few small donations. And now we are able to give hundreds of pairs of socks and over 100 blankets each year on Christmas Eve to the different facilities.
And this year we're expanding to private homes that have people in their facilities, which we haven't done before. So we'll think it's a worthwhile project.
Well, the one lady at Colonial Vista, it must have been a while before she had received a gift, and she started to cry when Mom handed her the blanket. And she looked at Mom with big tears in her eyes and says, "Oh, please don't let them take this from me."
Blossom Valley Assisted Living and Blossom Creek Memory Care. And this is Courtney Benson with Blossom Creek and Blossom Memory Care too. And as you've already met, Leilani and Carmen, the founders of Warm Souls. And Blossom Valley and Blossom Creek have been recipients of Warm Souls for several years. And this year we decided, after me finding out that they fund this almost solely between the two of them, I thought, oh no. They buy so much for so many. We want to have this drive for them. So we decided to do this drive-by, and then we're also going to be collecting through the month of December at Blossom Valley and Blossom Creek for Warm Souls. So the slipper socks, the lap robes, the blankets, and monetary donations made out to Warm Souls would be wonderful. But I've seen what happiness these two bring to our residents. Personally, they love them and they're so happy, and it might be that it's something that nobody thought of for a gift, or it's somebody that doesn't receive gifts. But I have to tell you, it puts a smile on everybody's face. So we want to thank these two and just give back to Warm Soul.
Thank you. Thank you, Rhonda.
Just something as simple as seeing the memory care patient get socks that are colored and bright. You can see it brings smiles and happiness and joy. It's something that's out of the norm. They are in a chair where they're looking down, they're seeing their feet, and it's colorful and it's bright, and it's not just blah. It gives them something to look forward to. It's something that makes them smile, and really you can tell that it touches their hearts.
And she had moved here from the Seattle area, and she had really no family left except for a niece that lived like in Massachusetts or somewhere far away. And she got one of the blankets, and she had just been in rehab, got out of rehab, and the lap blanket that she had was a very tattered old comforter that had been like cut in half. And she probably did it years ago, but she got this blanket and I remember it was gray, and she would just touch it, and she kept saying, "This is so luxurious. Are you sure? I don't deserve something like this." And it's like, absolutely, you deserve it, you know? And this was a gift from Warm Souls, and I explained to her, and she was so thankful. It was one of those real tearful moments where it's something that we take for granted sometimes, what it means to somebody else, you know?
Well, when they sit in their wheelchairs for so long at a time, their circulation ceases. And so the blood doesn't get down to the toes and down to the feet and warm them up like it should. So these are like a hug, a warm hug.
And the blankets are also soft and, oh, I mean, cuddly. So soft and cuddly. You know?
Mm-hmm. They're all like
and
that.
like a hug on your feet too. So we got blankets, beautiful socks. I mean, who wouldn't want something like this? I just love them.
They're so sweet. Wow.
Today we're doing a drawing to win a Thanksgiving dinner. We thought, here it is, the week before Thanksgiving, let's give away a Thanksgiving dinner. And so we have an enter to win here.
All the fixins.
All the fixins. We're not gonna cook it for you, but we're gonna give you the turkey and all of the potatoes and the dressing and everything that goes with it. So everybody's been putting their enter to win in, and we'll be delivering that this afternoon.
It's been a costly endeavor, but one that we know has been very, very appreciative.
We don't do Christmas exchange with each other. I mean, we use our money to do that. We get just as much satisfaction out of it.
My dad's name was Dale Johnson, and a lot of people know him from Wells and Wade, and that's who this was formed in memory of.
We've been getting socks and blankets and monetary donations. I think so far we're $30,
$50.
$50 today. You know how many slipper socks we can buy with that? Woo! Yeah. And you can keep sending the money in to Warm Souls. And that'll be posted on Blossom Valley's website or our Facebook page. And it's there now. You can go in and you can see. And we've got flyers here. The Senior Center has flyers. Sorry they're not open, but they will be in the thrift store. So through the month of December, drop off your donations to Blossom Valley Assisted Living or Blossom Creek Memory Care.
My name is Diane Tribble. I'm with Aging and Adult Care, and our mission is to enhance a person's ability to maintain a life of independence and choice. What that means is if you are elderly, an adult with a disability, or chronic illness, we have services and programs to help you remain safe and independent at home. These services and programs include things such as bathing, dressing, assistance with housekeeping, meal preparation, supplies, medical equipment, and more. We are funded by state and federal government, but we have many programs that are of low cost or even free based on your resources and income. We're here to help you remain at home and independent for as long as possible, and so please reach out to us at 1-800-572-4459. That's 1-800-572-4459 for Aging and Adult Care of Central Washington.
Currently, we're in the middle of a pandemic, and people have a lot of time on their hands. And so for a criminal, they also have a lot of time on their hands. Fraud is a cyclical crime. It occurs more frequently, typically, around the times when people are moving money. So given the fact that we're in a pandemic, most people are at home, they have a lot of time on their hands, and now we're approaching the holiday season, fraud is occurring, and it's costing a lot of people a lot of money. So the scams targeted at seniors really are the sweetheart scam. That's where when you're older and a spouse or significant other has passed away and now you're looking for somebody else who's got similar interests, be very, 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 very careful on any of the adult dating sites. The next scam that is 100% targeted towards seniors is the grandchild scam, the grandkid scam. That one is, they're really playing on your sense of family, that a family sticks together, that we take care of ourselves. And oh, by the way, don't tell mom and dad, because it's really embarrassing. Again, that is really driven. They're hoping that your family is large and scattered across the country. And again, if you get that call, it's worth a phone call to ask, if they call and say, "Hi, I'm John, I'm in Atlanta and I just got arrested and I need $5,000 bail." Okay, John, that's cool. I'm going to call your parents and have a chat. You don't have to tell the parents necessarily that, you just took this phone call. You can definitely call them, they're your kids, and say, "Hey, how are you? How are you doing? How are your children doing? Where are they now?" That will answer your question a lot better and a lot cheaper than sending that money out. The last one that's really, really targeted towards seniors, again, is that lottery scam. That's the one where they're hoping to find somebody who's in a financial, they got a little bit of money, not a lot, and they want more, which I think pretty much describes all of us. And they're trying to convince you won something you've never heard of. But again, if it's a random draw, you've got to understand, at some point you have to enter it. In United States law, and Washington state law, says if it's a lottery, it has to be clearly identified as a lottery. You have to have an entry form. Now, it's not necessarily something you write out, but there has to be a described method of entry. You can't just randomly pull people's names and then give them a call and say, "You won." When you think about that in a rational moment, how do you get the prize pool together if nobody's paying an entry fee? Those are the ones that are really targeted towards seniors. The official scam, somebody calling in saying, calling you at home, and I personally had somebody call me on my work cell phone and tell me they were with the United States Social Security Service, which sounds really impressive, doesn't exist, and that my Social Security number was being inactivated. And they had a little bit of an accent, and of course I tried to play along with them and ask them, "So what's going on?" They'll call anybody. If you pick up the phone, they're gonna talk to you. If you gave your phone to a 3-year-old toddler, they would have a conversation with them. They don't care. But those first three, the sweetheart scam, the grandkid scam, the lottery scam, those are really targeting seniors, and they're really trying to get you to buy into the fact that this is something you need to deal with now. So the utility scam's a variation of the official scam. That's where somebody calls you up and they say, "I'm with Chelan County PUD, I'm with Douglas County PUD, and you're X number of months behind on your utility bill." If they're calling a business, they will try to get you to take cash out of the till and go buy, ready for this, a gift card. If you're a citizen, they're going to try to get you to wire money to them. And again, now we come down to that payment. One of the indicators that this is a fraud. I want a gift card. I want you to wire me. If you get to that point, that is a major, 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 major red flag. At that point, you say, "All right, phone's dying. Everybody's Apple phone dies. Don't worry about it." Hang up on them. That's a great time to pick up the phone and call who they said they're from. Call the PUD. Because the PUD is not going to call you at 10 p.m. No offense, your business is important to them, but not that important. Their billing crew works normal business hours. And if there is an issue and they call you, there is no problem, and it doesn't matter if it's the PUD, waste management, City of Wenatchee, if somebody calls up and says, we're with the City of Wenatchee, we're going to turn off your water unless you send me $500 in Google Play cards. That's okay. It's okay to say, right, hang on, my phone's dying. I'll get back to you. Hang up, pick up the phone, call the city and say, hey, it's my water getting turned off. It's so much better if you take that one step, because you will save yourself a lot of money. If something comes up on your phone, and I know we're all attached to our phones, I understand, but you can walk into any number of different places and have them check your phone rather than letting some criminal get in there and lock it down. There are so many different scams out there. Hopefully I've given you a little bit of information to work with so that you can go through this holiday time, enjoy the time with your loved ones, keep your hard-earned money with you and them, and not give it up to some scammer who's drinking an umbrella drink in some sort of a Caribbean island. They don't need your money. Hang on to it yourself. I'd like to thank you for watching this, and hopefully you have a Merry Christmas and a Happy New Year.
Hi, I'm Jim Heinlein, independent agent and owner here at Springwater Insurance Group in North Central Washington. And at Springwater Insurance, we have offices all throughout North Central Washington, and we love to help people with their Medicare. And earlier in some of our broadcasts, I talked about open election period, and I'd like to touch on that a little bit more. So what that is if you have a Medicare Advantage plan, you obviously have decided what you want to do before December 7th, and it's going to start January 1st. But we really want you to understand that on January 1st and no later than March 31st, you have one more opportunity to change your Medicare Advantage plan. Maybe you want to use a different Advantage plan, or perhaps you should go back to what's called Original Medicare and pick up a Medicare supplement. And why would you want to do that? Well, maybe you've used your Advantage plan and you realize that copays really don't work for you. Or perhaps you've had a health change and having a supplement where, yes, they charge a little bit more money, but that's suitable for somebody who maybe is facing some really serious challenges. But in any situation, give us a call and we can guide you through that process.
Dave Tosh, Executive Director, Wenatchee Valley Senior Activity Center. Today I'm with Dr. Steve Kaster. He's been a long-term board member with the Senior Center. In fact, I think you arrived on the board about the same time I became the Executive Director. We've been working on this now for, well, we're going on 8 years. And I've always really appreciated Dr. Kaster's advice and counsel on a number of different areas, as it relates to the Senior Center. Right now, this is a prime opportunity, though, to find out what he really does, because he's been heavily involved with this whole COVID-19 issue with regard to the vaccinations and all that. And he's going to talk to that. But his title is the Medical Director for the Research Department under Confluence Health. And he's been a busy man. So tell us a little bit about the process so far, and maybe get us a little bit of up-to-date news.
Well, basically, we've been involved in the development of the Pfizer COVID-19 vaccine. And our role has been in the larger phase 3 study, and that's the study that recently led yesterday to approval by the FDA and their vaccine advisory group for emergency use authorization. And the Pfizer vaccine, the first studies got started in the spring. And that was the phase 1 study that was first in human, a small number of people in it. And that was done on the East Coast, and that was done in Germany. And we learned a lot from that study before going into the larger trial. And what we learned from a safety standpoint was that most of the side effects that were reported were the same kind of side effects that you will frequently see with other vaccines. So things like pain at the injection site was very common. Headaches, muscle aches, and fatigue were not uncommon. And there weren't really any serious adverse events that came about from that. And then from an effectiveness standpoint or efficacy, we learned that people, by measuring the antibodies in their blood, we learned that people made a very good immune response and not only with antibodies, but with white blood cell activation as well. And in fact, those protective levels were noted at higher levels than even those that had been infected naturally with the COVID virus.
So this has been a long time in process.
Yes.
And I know that there's a lot of information that's starting to be passed around, I suppose, from people that may not be in the know. Should we be concerned about any of this in terms of, the vaccine being something new and you've gone through all the testing, so I guess you're pretty comfortable with what we've got so far.
I think I can answer that question by going further and giving you more information on the large phase 3 study that's been done globally, and that's the study that we're participating here at Confluence Health. And we have about 170 subjects enrolled in that study. But globally, this is a big phase 3 study, so there's over 40,000 people enrolled, and that's where this data has come from that led to the emergency use authorization. And so we learned, again, from a safety standpoint, pretty similar to the phase 1, with symptoms like injection site pain, muscle aches, headache, fatigue, and most of those were all ranked mild to moderate. There were some severe, and most would come on about the same evening or the day after of the injection, and then abate pretty quickly within a day or two in general. And then from an effectiveness standpoint, we don't know the data as far as the antibodies levels, but what we're really measuring and monitoring on the study, who gets COVID and who doesn't. And the way we track that is every patient that comes in, every subject, that from day one they're given an electronic diary on their phone. And if they do have COVID symptoms, they enter it in the diary, we call them. And that's how we track who gets COVID and who doesn't. And so far, the last interim analysis showed 170 subjects globally who have acquired COVID on the study. And of those 170, 162 were placebo, and 8 were given active vaccine. And again, there have not been any significant serious adverse events or patterns that have been of concern. But it's still early. And if you're asking me about my opinion so far, I would be very willing to have myself vaccinated. I would encourage my family members to get vaccinated with the information that we have so far on this study. I think that they should focus on not losing their focus and continuing to do the best we can at masking. And this is going to be still critical even once the vaccine gets underway. The masking, the distancing, the hand washing, the not going out unless you have to, things like that are going to be still supremely important because they work.